It used to be if you wanted a perfect smile, you had to live with braces for a while. You could get some dental implants for missing teeth, or you could go ahead and get veneers, but those things can come with a price tag. There is an easier, much less expensive way to get your teeth perfect. And joining us now is Dr. Terri Alani, the Texas Tooth Lady, and her patient, LaShayna Thompson, and she loves her snap-on smile. When we say you can get it in a snap, we mean you can get it in a snap.
It is in a snap. It is a removable appliance. It is affordable. It doesn't require any alteration to your existing tooth structure. It's made of a non-toxic resin. It lasts 3 to 5 years, and it has totally changed the way we practice dentistry.
Yeah, all right, because we're looking at this right here that I have in my hand. If we can get a close-up of that. So this is the structure that you're talking about. So you have your basic teeth. You can see here on this mold, it looks like this person had some teeth that were not uniform, and there are a couple that are missing, right?
Yes, what it can do is it can close gaps. It can replace missing teeth. It can change the shape and size of your teeth. Basically, it's like a veneer grill.
Yeah.
That's how we would say it. And it does not stain, and you can eat with it.
All right, LaShayna, you have such a beautiful smile.
Thank you.
But that smile, you were hesitant to reveal to folks before. Why?
Well, actually, I've always had a gap. Like my dad just blessed me with that gap. And I love my gap, I do. But when I would take pictures, it would be like I'm there, but I'm not there. And I'm obsessed with teeth. I love.
You love you some teeth.
Ooh, I love teeth. Shamar Moore, if you're looking, I love your teeth.
And I love Shamar Moore.
And I love Shamar Moore. But I love a beautiful smile, and I can tell the difference when I take my pictures. Like now, the pictures just look flawless. So teeth, it's everything. Yeah. To me, it's everything.
Well, it's funny because I walked out there and I knew you were coming on the show. I knew she had a snap-on
Yes.
smile, but I looked at her mouth and I went, oh, she doesn't have them in yet because her teeth are perfect. And I went, oh, no, she does have them in.
I have them in.
They're perfect, right? It is
It's amazing.
crazy right
It's
there.
perfect.
All right, so here's the deal. When you're having them made, so you not only make them so they look uniform and look right
Yes.
in somebody's mouth,
Yes.
because people can get something like a snap-on smile. The key is dealing with, I think, a dentist who's like an artist
It
as
has
well,
to be
right?
customized. Stay away from the internet appliances. They do not work. They're not custom made. We send the patient for digital impressions, so they're absolutely perfect, and we get digital previews from the lab, so I tweak them before the patient ever sees them.
Yeah, and also even the right color. Everyone thinks they want white. Yeah. It's gonna be white, 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 right? But super white might not work on one person. It may look better on another person, and her teeth are just
No, her teeth are perfect.
Thank you.
So
All right.
should she take them out?
I think you should take them out.
Okay, awesome.
Yes, to show people what we were talking about right here. Okay, there you go.
And
look-
show them your teeth before.
Oh,
There
yeah,
you
the
go.
bottom ones too.
The
Smile
bottom ones,
big.
too.
So you can see she has a gap. Now you're thinking your teeth are probably perfect, but one's shorter than the other. These are flawless. They're whiter, more symmetrical. And the other question I have, and this is what I get asked all the time.
Can I eat with
Can
that?
you eat? Would you
Yep.
like to show us, girlfriend?
Absolutely.
Look, we talk about in a snap. There it is. Snap bottom.
They totally
Snap
snap
top.
into place. No adhesives, nothing.
All right. Have yourself some food over there.
Yes.
Yeah.
And actually, I'm going to just say this really quick. I went to a banquet last night, and I ate a full-course meal. So you can actually eat with them. You don't have to be ashamed like they're going to fall out or anything, because I grew up. So I'm going to do an apple.
But you're right, Dr. Alani, because a lot of times people wear dentures. The dentures could actually slip out, right?
Actually,
So-
and people ask me all the time, can you eat with them? They don't believe me. Yes, you can eat with them because they literally snap into place. They're held in by retention. There's no adhesives, there's nothing.
All right, let's go through who this is who's a great candidate for this. Obviously, she's hiding the gap there and then getting some uniformity with her teeth. But there are
Exactly.
people who have some missing teeth.
Right, if you have more than 5 missing teeth in a space, you're probably not a good candidate. If you have no teeth, you're not a good candidate. If you have flared teeth, you're not a good candidate. And if you have gum disease, you are not a good candidate, nor if you have active tooth decay. It sounds like a lot, but basically when you come in, you're going to get a full exam, x-rays, have your teeth checked to make sure your hygiene is great, there's no active decay, and then we assess you. About 85% of patients that come into our office are good candidates.
Yeah, because you get missing teeth, stained teeth, teeth gaps, a gummy smile. Actually, anytime someone doesn't really like their teeth, you can pretty much correct any of those issues.
Absolutely. We have options from A to Z, Deborah.
And something else I want to say too, Dr. Alani, is that I think a lot of us who have decent teeth underestimate what that does to someone's self-esteem. You had your gap, you said you loved your gap, but there are other people you've had come in your office who needed to go to a job interview. And we struggle certainly know that people make impressions about people who may have a missing tooth or something. But for you to be able to do that to them, to see the difference in their face. When
It's amazing, and we shoot a lot of videos for YouTube. I have a YouTube channel and Facebook, and the response is priceless. These patients tear up. We are life changing. Now hers wasn't such a significant change, but it really boosted your confidence.
Oh yes, I mean, I don't put a camera out in front of me. And selfie sticks, I got every color for a selfie stick. So yes. With me, like I said again, the pictures, I love taking pictures, but it was like I was there, but I wasn't there. And so now
you zeroed in on your gap all the time,
yes,
right?
I was like, oh, look
What
at that gap.
other options did you consider before you knew about Snap-on
Oh
Smile?
my goodness, I so wanted to do veneers, but I couldn't, the veneers, but I couldn't afford veneers. I can't afford that. Yeah. And so I was just kind of on the internet, and I was surfing the internet, and Snap-on Smile popped up, and I seen Dr. Alani, and she was actually on the show with you, and I called the very same day. And so ever since then, I'm actually want to give me another pair. I love
Just to have a backup pair?
I want to get another backup pair. I love my teeth.
Have something else to eat, and
Yeah,
I'm going
right,
to show you
right.
some more before
Something
and
after
after.
pictures.
And this one is a
pictures.
really
Yes.
good example. This is a pretzel.
It's a hard pretzel there, yeah, yeah. And there you go. All right, let's look at some other before and after pictures. You're right, of the types of things that you can fix.
So
there.
this is just a color change. Basically, the patient had nice teeth, but we went ahead and changed the color. You can see it looks just perfect.
Right.
And
Okay.
then
The next one there,
this
the
one
gaps.
is amazing because we not only whitened your teeth, we linked them a little bit, and we corrected missing spaces, closed the gaps. And so you just get fantastic results. Here's another one. This is a gummy smile. We can actually increase the length of the tooth so we can hide a gummy smile.
Yeah.
A lot of patients come in for that.
The bottom line, they go to you. If they want veneers, they can get them because you do that
Absolutely,
also.
we do.
But this is just an
full
easy way to get it done.
dental office.
A lot less.
I love Snap-on Smile.
Me too.
Okay, well there you go. And if you'd love to have Snap-on Smile as well,